Hi, we're just going to walk through the building just so you can see where the choke points are, because most primary care buildings are not fit for purpose. They're not fit for COVID, they're not fit for taking mass numbers of patients through. So just follow me through. As we enter the building, everyone has to use a hand sanitizer. As you come through, you'll see some spots on the floor where patients need to wait until there's space for them to come through. The waiting room, pre-COVID, would have taken 18 to 20 people, can now only have 2 people in it and no more. And that's due to COVID restrictions and the space that people need and the ventilation. We've got our back door open because that's the one-way system where patients go through and leave the building. And we've got a reception hatch which actually has a spacer in here to keep people away from the actual reception desk. Coming through, you'll have seen the spot on the floor where people stand for reception. And coming into the room, this is where we will bring patients through. When a patient comes in for a face-to-face appointment, before they come in, we have to wipe every bit of the room down that any previous patients have been in. We have to make sure that every touch point has actually been cleaned. We then need to put some gloves on, as well as our masks. We put on a plastic visor and we put on a plastic apron. So the time taken to get an apron out, put it on, put your gloves on, put a visor on, clean the gloves, and then go and actually get your patient in, bring your patient through, sit them down, do a consultation, and then as they leave, you've then got to actually take those gloves off, put another pair of gloves on, clean the room down, and then take off your gloves, your apron, your visor, and change your mask between each patient. That's why a face-to-face appointment takes 20 minutes rather than your 10-minute consultation. And that's why, if we have to do more face-to-face appointments, your access to your GP is going to get less, because there are only so many hours in the day. And if we actually have to take twice as long with each patient as we would do on a telephone call or on an electronic online consultation, we will not be able to deal with as many patients. There are not enough GPs to meet the demand. So when we talk about access to GPs, we need to talk about capacity. And you need to think about where you're going and who you're going to speak to and who is the right person to speak to. So when you think about a health problem, think about where you're actually going to be most appropriately dealt with. Think about, could you go online? Could you look online for symptom checkers? NHS.uk will actually tell you an awful lot about most problems. Can you actually go to your pharmacist and have a word with your pharmacist about what's going on? Is there anybody else that you can talk to that might be able to give you some help and support about simple problems? Can you actually go to 111 and give them a call and ask them about the problems that you're having and get some clinical advice from them? Can you use the online consultation tools that your practices have on their websites? And if all of those are not appropriate for you, then you can always call your practice and actually ask for either a telephone consultation or even a video consultation. And then, if the clinician feels it's appropriate, you could be invited in for a face-to-face. But all of these other options are things that will reduce the number of phone calls coming into practices and make it easier and safer for those that have no other option or cannot use those other options. And we need to consider, as a country, as a group of patients, how we can preserve that time, because there is no horde of GPs available to come and give extra hours of support. And what we need to do is make sure we use the time available as safely and as effectively as we can.